Asthma and Allergy Foundation of America puts Memphis in the top 100 of allergy capital in the U.S. of 2026. The following portion of Live at 9 is sponsored by Mid-South Ear, Nose, and Throat. And joining us to discuss treatment is Dr. John Touliadis. Allergies and sinus disease are a huge problem in the Mid-South. What are some ways to prevent them from turning into an infection? Because I feel like it happens all the time.
Yes, we take so much for granted until it goes wrong. But, our sinuses produce mucus daily, 1 to 2 liters actually every day. That's more than the saliva we produce. And we just, swallow it down. But this is created to filter out things that can be harmful. But a lot of folks in the Mid-South particularly struggle with a lot of allergies. And allergies are inhaled antigens that can stick inside the nose and sinuses and cause a lot of inflammation. So one way to prevent that from turning into infection is to just do simple saline irrigation of the nose and sinuses. It's a very proven preventative measure, because if those antigens just sit inside the nose, it leads to inflammation.
So just
it can clog your sinuses, flushing it out. And high volume flushes, you have things like neti pots and squeeze bottles, and now they have motorized ones as well. And that's very good. And in some folks, that's not quite enough.
Right.
And so if you have bad allergies, in addition to the washing and the flushing, you would want to treat it with medicines.
Got it.
And ideally, we like to medicate where the problem is. So typically, we prefer as ENT physicians to try to limit the medicines to the nose and sinuses. So we have intranasal steroid sprays as well as intranasal antihistamines that are great to use. So you irrigate, clean the nose out, prepare it for the medicines. You spray in a little intranasal steroid spray and potentially a little intranasal antihistamine, and that can oftentimes prevent infection.
And then what happens if you keep getting a sinus infection over and over?
Yes.
I didn't even know, because it's like, what type of, when is it time to consider surgery? I didn't even know you could have surgery for sinus infection.
Yes, and oftentimes there's more going on than just recurrent infection. There can be polyps and growths and a lot of things that can be very problematic. But typically, if the medicines and the rinsing isn't covering it, then we consider allergy shots, immunotherapy. And if continually you still are getting infections, usually 4 or more a year, it's really time to seek a specialist, at which time we will examine the sinuses with endoscopes as well as imaging, and determine if you're a candidate for a procedure that can help.
Okay, and then finally, if a person has a thyroid nodule, when do they need surgery, and what is a thyroid nodule to begin with?
Yes, so I brought a little model. I have a lot of things at the office, but the thyroid gland sits low. I have this big Adam's apple, so the thyroid gland is lower in the neck. And so if you feel a nodule, or your primary care doctor feels a nodule on your thyroid, it's worth getting examined. Thyroid nodules are very common, but fortunately, most of them are benign, and those that are malignant are very treatable. Outside of skin cancer, thyroid cancer, if you have to get one, is one of the better ones to get because it's very curable. We don't have a very high mortality rate, which is great. But if you get one, it needs to be evaluated. So we do ultrasound evaluations, sometimes needle biopsies. And if there's suspicion for malignancy, or if a benign nodule just continues to grow and cause swallowing problems, it's time to consider surgical intervention.
Thank you so much for this fantastic knowledge.
Thank
we
you.
really, truly learned a lot of stuff going on.
Well, I appreciate you having me, Corey.
Of course. Well, the preceding portion of Live at 9 was sponsored by Mid-South Ear, Nose, and Throat.